This week in lab, we're going to be going over Lab 5, which covers the blood vessels. So these are the vessels that transport oxygen and nutrients from the heart to our tissues. I wanted to do a quick review as this information is also pertinent to this week's lab. So arteries, they're responsible for carrying blood away from the heart and supplying oxygenated blood to tissues, while veins, on the other hand, are responsible for draining blood from the tissues and returning that blood to the heart. The circulatory system is divided into two separate components. So there's the systemic circulation and pulmonary circulation. Now keep in mind that the heart itself does also have its own blood supply, which goes directly to the myocardium. In the systemic circulation, arteries will be carrying oxygenated blood and veins will be carrying oxygen-poor blood. So oxygen-rich blood will leave the heart through the aorta and travel to the different tissues in the body, while the veins on the systemic circulation will collect that blood, return the deoxygenated blood to the heart. The pulmonary circulation, on the other hand, the veins will carry oxygenated blood and the arteries will carry oxygen-poor blood. So if we were to continue with the blood flow going into the vena cava, the blood will travel through the pulmonary arteries, and this is deoxygenated blood, where it will enter the lungs to become oxygenated. From there, the oxygenated blood will travel through the pulmonary veins and enter back into the heart through the left atria. Leaving the heart, arteries will branch to form smaller and smaller divisions until they reach the capillary bed where the oxygen and nutrients can be exchanged, in addition to waste products. From there, the capillaries will converge into what are called venules, which are smaller versions of veins, and then the venules will converge further to form larger vessels until traveling back to the heart. Next, we'll be looking at the general differences in blood vessel structure. The artery is the vessel that's on the left-hand side of the screen, and the smaller vessel in the microscopic image. Note that under microscopy, the artery has thicker walls and is a circular shape. The vein, on the other hand, has a larger lumen, smaller walls, and is collapsed. A question to consider is, why do arteries have thicker walls in comparison to veins? The arteries must be able to expand as increased volumes of blood are propelled into them, and they must be able to withstand the higher pressure. Veins, on the other hand, are a low pressure system and therefore don't require thick walls for their functioning. Veins return blood to the heart and they have valves which help prevent backflow. So blood vessels are composed of three separate layers: the tunica intima, tunica media, and tunica externa. These three layers are found both on the artery and the vein. However, on the artery, the tunica media tends to be significantly thicker in comparison to the vein. The tunica intima is the innermost layer, or the layer that is intimate with the blood. So this layer lines the lumen, which means that it is in direct contact with the blood that is passing through the vessel. The layer is composed of simple squamous endothelium, a subendothelial layer, which just means the layer that is beneath the endothelial layer, and an internal elastic membrane. The tunica media is the middle layer. This layer is composed of smooth muscle cells and elastin and has a role in vasoconstriction and vasodilation. So again, note that the arterial wall, the tunica media, is thicker than the venous wall in comparison. The tunica externa is the outmost layer, or the one that's located on the outside. It is composed of collagen fibers and what is called the vasa vasorum. So this essentially means vessels of the vessels. It's a tiny system of vessels that nourish the external tissues of the blood vessel walls themselves. The tunica externa functions to basically support and protect the vessel itself. Next, we'll be covering the major systemic vessels. Some techniques I wanted to share with you guys to learning these is first, notice that many of the arteries and veins share the same name. They run parallel to one another and are similar on the right and left sides of the body. So really, once you learn the arteries, you have already learned the majority of the veins. I also recommend to begin at the aorta and trace the pathway of blood. It can be helpful to actually just write this down on a piece of paper. You don't actually have to draw the vessels, but you can just put the name in little boxes and draw the connections for the pathway blood would take. Another phenomenon that can make the study of vessels challenging is that the names of vessels change with their location. So like a street that changes names as it passes through an intersection, an artery or a vein can change its name as it passes an anatomical landmark or branches. So for example, the subclavian artery is located just beneath the clavicle, and it will become the axillary artery as it passes through the body wall into the axillary region. The aorta is the largest artery in the body. It arises from the left ventricle and descends into the abdominal region. Arteries arising from the aorta distribute blood to virtually all the tissues of the body. The aorta consists of the ascending aorta, the aortic arch, and the descending aorta, which passes through the diaphragm. After passing through the aortic semilunar valve, blood will travel through the ascending aorta, which moves in a superior direction. The vessel will arc to the left, forming the aortic arch. The superior aspect of the aortic arch first branches into the brachiocephalic artery and gives rise to the right subclavian artery and the right common carotid artery. The brachiocephalic and subsequent arteries supply blood to the head, neck, upper limb, and wall of the thoracic region. The next branch off of the aortic arch is the left common carotid artery. Both the right and the left common carotid arteries supply the respective sides of the head. The left subclavian artery also arises from the aortic arch. The subclavian arteries supply blood to the arms, chest, shoulders, and back. The aortic arch will descend inferior into the inferior portions of the body. The descending aorta continues into the thoracic aorta and the abdominal aorta. Next, we will cover the arteries of the head and the neck. One thing to note is that if an artery starts with the word common, that means it's going to branch into two separate arteries. For example, the common carotid artery is going to branch into the internal and external carotid arteries. The internal carotid artery supplies blood to the brain, while the external carotid artery supplies blood to numerous structures in the face, lower jaw, esophagus, and larynx. The vertebral artery is posterior to the common carotid artery and arises from the subclavian artery and passes through the vertebral foramen and supplies blood to the brain and spinal cord. From the aorta, we'll trace the arteries that serve the upper limb. So the aorta will branch into the brachiocephalic artery, which will become the right subclavian artery. So sub is meaning beneath, and clavian is referring to the clavicle. As the subclavian artery exits the thorax into the axillary region, it becomes the axillary artery. So the axillary region is referring to the armpit region. The majority of the vessel continues into the upper arm or the brachium and becomes the brachial artery. The brachial artery supplies blood to much of the brachial region and divides at the elbow into smaller branches, including the radial and the ulnar artery. The radial and the ulnar artery run parallel to their namesake bones. One way to remember which one is on top versus which one is on bottom is that the ulnar artery is underneath the radial artery. As blood flows from the left ventricle, it'll pass through the aortic semilunar valve into the ascending aorta, through the aortic arch, and through the descending aorta. The thoracic aorta begins at the level of the T5 vertebrae and continues inferiorly to the diaphragm. The abdominal aorta arises from the thoracic aorta and travels inferiorly, dividing into the left and right common iliac arteries. Before this division, the abdominal aorta gives rise to several important branches. A single celiac trunk divides into the left gastric artery, the splenic artery, and common hepatic artery. The left gastric artery supplies blood to the stomach and to the esophagus. The splenic artery will supply blood to the spleen. The common hepatic artery will eventually branch into the hepatic artery proper and the right gastric artery. One thing to know about blood supply is that a lot of the organs that the artery actually supplies are given away in the name. So like splenic artery supplies blood to the spleen, splenic is referring to the spleen. Two additional single vessels that arise from the abdominal aorta are the superior and the inferior mesenteric arteries. The superior mesenteric artery branches into several vessels that will supply blood to the small intestine, pancreas, and majority of the large intestine. The inferior mesenteric will supply blood to the distal segment of the large intestine, including the rectum. In addition to the single branches of the abdominal aorta also gives rise to several paired arteries along the way, including the renal arteries, which supply blood to the kidneys. The common iliac artery divides into the internal and external iliac arteries. The external iliac artery exits the body cavity and enters into the femoral region of the leg, and subsequently is renamed the femoral artery. As the femoral artery passes posterior to the knee, the popliteal, it is called the popliteal artery. The popliteal artery will branch into the anterior and posterior tibial arteries. The anterior tibial artery is located between the tibia and the fibula and supplies blood to the muscles and integument of the anterior tibial regions. Now we will shift gears and look at the venous system. Recall that the arteries will converge with veins in areas called capillary beds, where oxygen is deposited into tissues and deoxygenated blood will return to the heart through the venous system. The superior vena cava drains most of the body superior to the diaphragm. On the left and the right sides, the subclavian vein forms when the axillary vein passes through the body wall from the axillary region. Remember, the axillary region is the armpit region. It fuses with the external and internal jugular veins from the head and neck to form the brachiocephalic vein. Each vertebral vein also flows into the brachiocephalic vein close to this fusion. Blood from the brain and the superficial facial vein flow into each of the internal jugular veins. Blood from the more superficial portions of the head, like the scalp and cranial regions, flow into the external jugular vein. Blood from the external jugular vein empties into the subclavian vein. The digital veins in the fingers come together in the hand and further come together to form the radial vein and the ulnar vein and the median antebrachial vein. The radial vein and the ulnar vein run parallel to the bones of the forearm and join together at the antebrachium to form the brachial vein. The median antebrachial vein parallels the ulnar vein and joins the basilic vein in the forearm. You can remember the basilic vein by it is the base of the forearm. As the basilic vein reaches the antecubital region, it gives off a branch called the medial cubital vein that crosses at an angle to join the cephalic vein. The median cubital vein is the most common site to where venous blood is drawn in humans. The basilic vein continues through the arm medially and superficially to the axillary veins. The cephalic vein begins at the antebrachium and drains blood from the superficial surface of the arm and into the axillary vein. You can remember the cephalic vein because if you lift your arm up and wrap it around your head, the cephalic vein will actually would be in contact with your head as it's wrapping around. As it passes through the body wall and enters the thorax, the axillary vein will become the subclavian vein. From the dorsal venous arch, blood supply drains into the anterior and posterior tibial veins. The anterior tibial vein drains the area near the tibialis anterior muscle and combines with the posterior tibial vein and the fibular vein to form the popliteal vein. The posterior tibial vein drains the posterior surface of the tibia and joins the popliteal vein. The fibular vein will drain the muscles and the integument in proximity to the fibula and also joins the popliteal vein. The small saphenous vein located on the lateral surface of the leg will drain the blood from the superficial regions of the lower leg and foot and flow into the popliteal region, or the popliteal vein. As the popliteal vein passes behind the knee in the popliteal region, it becomes the femoral vein. The great saphenous vein is located on the medial surface of the leg and thigh and collects blood from the superficial portions of these areas. The femoral vein will drain blood from the femoral region and penetrate the body wall to become the external iliac vein. The external iliac vein will drain blood from the leg to the common iliac vein. The liver is essentially a biochemical processing plant. It packs nutrients absorbed by the digestive system, disposes of waste products, and produces clotting factors. Instead of entering the circulation directly, the absorbed nutrients will travel to the liver for processing via the hepatic portal systems. Portal systems begin and end in capillaries. In this instance, the capillaries from the stomach, small intestine, and large intestine and spleen lead to the hepatic portal vein and end in capillaries within the liver. The hepatic portal system consists of the hepatic portal vein and the veins that drain into it. The hepatic portal vein begins with the confluence of the superior mesenteric and splenic veins. It also receives branches from the inferior mesenteric vein plus the splenic veins. The superior mesenteric vein receives blood from the small intestine and 2/3 of the large intestine and stomach. The inferior mesenteric drains the distal third of the large intestine. The splenic vein is formed from branches of the spleen, pancreas, and portions of the stomach in the inferior mesenteric veins. After its formation, the hepatic portal vein also receives branches from the gastric veins of the stomach and cystic veins of the gallbladder. The hepatic portal vein delivers materials from the digestive and circulatory organs directly to the liver for processing.